Hello and good afternoon to our esteemed listeners. This is Sauti Radio, your number one health and well-being radio in Southeast London. I am pleased to introduce you to another health and well-being program where we shall discuss sexual health, PrEP, pre-exposure prophylaxis, and a miscellany of other sexual health-related issues of concern such as health inequality, dialogue about PrEP, access to PrEP and its uptake, especially among the Black community in the United Kingdom. I am your program presenter and moderator, Omai Obanda. My guest on the program is Akeem Ogunyemi, a Commissioner for Sexual Health at Haringey Council in London. It is a privilege for me to host and interview Mr. Ogunyemi on Sauti Radio at the Africa Advocacy Foundation. Thank you for tuning in and welcome to the program.
This is Sauti Radio.
Good afternoon, Mr. Akeem. I'm pleased to have you here today and should thank you for accepting Sauti Radio's invitation to the first phase of our interview with you. And the assumption here is that our listeners do not know anything about you. So maybe we should start by you introducing yourself.
Thank you very much, Obanda. Good afternoon to you too, and thank you for having me here. So my name is Akeem Ogunyemi, or Ogunyemi, as we like to, I should say it properly, being of Nigerian descent. I am the Sexual Health Commissioner at the London Borough of Haringey. Been there for quite a number of years now, and I lead on the operational delivery and commissioning of a range of services, both strategic as well as community-focused services in the borough. And I'm here today to try and have a conversation with you around, a very important and worthwhile resource or service, which I think is important that as our community we're as informed about as possible, so we can get as many people at least inquiring about it if they need it.
Yes, and this is pre-exposure prophylaxis.
That's correct.
Yeah, but in general, we'll be looking at sexual health as well, because that it leads to where we should be having or should be looking at pre-exposure prophylaxis. Yeah. But based on my engagement, especially in the recent past, in the community as far as the promotion of PrEP is concerned, I feel the majority of Black people of African heritage have spoken to me about PrEP, and in many ways they feel targeted. How would you respond to that, Mr. Akeem?
That's a really good question, Obanda. So I think there's two strands to that question. So I think the word targeted is draws up quite an emotive response from us as a community, because we know historically on a range of different topics, we've always felt that, mainstream community or the mainstream society, should I say, are either talking about us, talking to us, but never really talking with us. There's never really a discussion with our communities. And I think I need to emphasize as well before I kind of delve into that response a bit more, is that, we use the word African communities. We are a collaboration or a combination of so many different communities that come from a continent. I know there's this very lazy assumption that somehow Africa is a country, and therefore we seem to have one common language, and there's an assumption that we're a homogeneous group of people. Mm-hmm. We have shared commonalities in terms of migration and being either first generation, second or third generation migrants or British-born descendants. But the fact is, Africa has over 1,000 languages spoken, probably even more, ethnicities and cultural differences in terms of numbers. Mm-hmm. So therefore, we don't always receive and interpret information uniformly. Mm-hmm. But if there's one thing we do share is the assumption or the feeling, should I say, that being members of a Black African community in Britain, we always feel that we're on the peripherals, that we're never really fully engaged with when it comes to health and well-being initiatives that are pertinent to us as a community, and our thoughts and our thoughts and belief systems and understanding is never really taken into account. So it's only right, I understand why people feel that this is, this initiative is targeted at the Black African community. And like I said, I just want to emphasize, I don't think, I understand the word targeted, but I prefer to use the word focus because that focus means that we're creating a platform of to have a discourse, a conversation with our community. Now, the short answer is it's not been targeted at the African community because what we're saying is HIV, anybody can acquire HIV. That's the first point we need to make. And PrEP is the latest line of really good, innovative, groundbreaking treatment that's available that could really contribute to continued reduction in HIV transmission or HIV acquisition. And why shouldn't we make sure that if there's a drug out there that's as effective as PrEP in stopping an illness, which is considered long-term care management, HIV is a long-term care management illness now, that's available to other groups, why shouldn't it be available to the members of the African community?
You mentioned something very profound there when you said that Africans, most of the time, especially in a country like the UK, we find ourselves on the periphery. And the question here, maybe this is a question to you. Do you think we find ourselves on the periphery because it takes us long to understand where the environment we've migrated? It takes us long to integrate with the community. Why do you think there's that disconnection? I mean, would a Chinese, for example, an Indian have the same view of other Indians or Chinese settled in the United Kingdom?
So I can't speak for the Chinese or Asian community. And I certainly can only speak to a certain degree for our community. Because like I said, we are a very diverse community. But I think one of the factors is, and I think you have alluded to it, sometimes if you're a new migrant, and I think that's universal in any new migrant communities, you're trying to navigate your new environment. You're trying to understand the lay of the land. You're trying to understand where you fit in, whether you're going to be accepted. But I think we can't dismiss or skirt around the big issue here, which is it's still got to do with racism and preconceived ideas about us as Africans and a negative disposition towards us sometimes, which unfortunately I think for a lot of people, once they experience racism, it has a profound effect on how they feel they can engage with services. And what happens is, word of mouth is very powerful. Personal experience is very powerful. So if I have a negative experience, going into a service and I believe that, that service didn't treat me in the same way that they treat somebody else because of my skin color or because of the perception of where I come from, I'm going to go back to my family and my friends, and I'm going to share that experience. Now, by doing that, and that quite rightly so, because I need to feel that I can get some kind of reassurance. But what that also does is it reinforces that same perception, or not even a perception. It reinforces that same belief in my friends and family to say, okay, well, do you know what? Hold on a second. Akeem said he had this experience. If I'm going to go down here, if it happens to them as well, which likely it's going to, it then it just resonates right across our group and then our community. So I think, we feel that we're on the peripheries because, like I said, racism is a reality. And just to give an example, a more recent example of what we have right now, where we know that, the National Health Service is going through a period of serious, review around antenatal antenatal support for Black and Asian women, where there's been recent disclosures about Black women and Asian women's experience during childbirth, which has been very unpleasant indeed, where they felt that they've not been given the same level of attention and the level of care as their white counterparts. So we can't skirt around the issue. It does have an impact, and people's perception of how they think they will be treated is very powerful in determining whether they will engage with services and do it in a way where they feel they're going to get the right outcome.
But then I'd like you to talk to me about sexual health. First, even before we get into pre-exposure prophylaxis.
Yeah.
What is sexual health? In very basic.
Yeah, that's a really good question, Amanda. So, I mean, sexual health is really your ability as an individual to be able to understand, and navigate the right, a safe and healthy relationship. So sexual health is basically, it covers your emotional, mental, as well as physical disposition. And it's about you making sure that, whichever way you engage in your intimate, relations with people, you are able to do it in a safe and consensual environment without feeling coerced or pressured, and ultimately also without feeling that you may have put yourself at unnecessary risk. So it's really about being as informed as possible, so that, when you go through, when you've had that hopefully a lovely experience, you don't feel any form of anxiety or emotional. I think anxiety is the right word. After when the deed is done, as they say.
But then you would understand why I would be asking you this question, because to me and many others, I want to believe, when we hear about sexual health, the thing is just about, it's about the sexual encounter I had with somebody. We don't think about our emotional, we think about our physical, but it's more to do with what did I get that is negative out of that? Right. STI, for example.
Right. Yeah. Well, that's what I said about making sure you're doing the consensual in a safe way and minimizing risk to yourself. So, yes, exactly. The first question you asked me is what is sexual health, and I give you a broad kind of description of what sexual encompasses. But certainly, yes, of course, people have casual sex, and that's fine. But, making sure, even when having your casual sex, you're making sure that you're protecting yourself, because, ultimately, you can't take responsibility for the person you're having sex with. All you can do is take responsibility for yourself and what you do and how you protect yourself. And sexual health is about making sure that you are as informed as much as possible about how to do that in a safe and consensual way. So, for example, let's just use a very loose example. You want to have sex, with a new person. You should be confident enough to be able to say, I need to use a condom.
Okay.
Yeah? Because a condom will, stop an STI, stop HIV, and potentially stop, if it's a heterosexual relationship, stop unwanted pregnancy. Now, all that stage there is about you being confident enough with your sexual health understanding and knowledge to be able to say, yes, we're getting really intimate, it's getting hot and heavy right now. Actually, before we actually have full intercourse, let me take the condom out and let me use the condom. So it's about you being confident enough to be able to take that responsibility for yourself. Yeah, not delay, not what's the right word I'm using for? Not transferring that responsibility to your partner. It's your responsibility because you're looking after your own sexual health. Because when we anxiety and is a very, very emotionally draining experience. And for some people, if you don't take charge of your sexual health, and let's say after the deed is done, you can go for a roller coaster of emotions. I just had unprotected sex. I don't know if I'm going to get an STI. Don't know if she's going to tell me that she's pregnant. There's a lot of things that can go through your mind afterwards that actually can be avoided if you are informed and you understand what you need to do in order to keep yourself safe and well. And I think for me that is an element of good sexual health, because it's about informing that individual. It's about making sure that you as an individual as informed as possible to make sure that the sex you're having is consensual, it's safe, and ultimately the risks are minimized considerably.
So when we talk about PrEP, which is now gaining a lot of popularity, pre-exposure prophylaxis, where do you fit it in this scenario of sexual health? And in line also, rather in view of what you've just explained, why do you feel PrEP?
So PrEP to me is part of a combination of prevention strategies that's for reducing HIV transmission.
Just HIV?
Yes.
Or no syphilis, no gonorrhea?
No, just HIV.
Just HIV.
Exactly. And I think that's really important. That's a really good question you asked, because I think there's an assumption, and I'm speaking loosely. There's an assumption that when we have treatment available for certain things, people always tend to see them as magic bullets for everything, and suddenly think, oh well, this is available now, so actually I don't need to do this. It's that it couldn't be further from the truth. The reality is this is just focused on HIV, acquiring HIV and onward transmission of HIV, if taken correctly and with the guidance of the consultant when you're assessed and you've been approved for PrEP. So it's really important we say that it does not protect you against other STIs. It will not do that. But sorry, repeat your question again.
The question was, you spoke to me eloquently about sexual health, and I thought to myself, I'm currently involved in campaigns around PrEP, the use of PrEP. And my organization now, the Africa Advocacy Foundation, is championing that out there. I'm thinking, where does that fit in the sexual health?
Yes. So as I said, this is part of PrEP is part of the combination prevention strategies for HIV. Very effective. We know it's very effective for HIV. In terms of other STIs and preventing other STIs, of course, we can't forget condoms. Condoms is still the go-to approach for making sure you reduce onward transmission of STIs or getting, so not onward, but getting STIs.
You're listening to Sauti Radio. Your number one online radio.
Mr. Akeem, maybe it's time for you to talk to me about PrEP, pre-exposure prophylaxis. And I was just wondering, it seems to me PrEP is a very good prevention drug. The question here is, how safe am I with it? And once I have taken it, does it mean I'm free from any STIs?
Right, you're asking some really good questions here, Obanda. So, I'll again try and do justice to your question. So, first of all, PrEP is very effective for what it's been designed to do, and that is that it's been designed to stop the acquisition or onward transmission of HIV. Okay. It is not a magic bullet that will stop all types of other forms of sexually transmitted infections. So the underlying message there is safer sex practice is still of the utmost importance. You still need to use condoms because you can still acquire other STIs. You still need to do regular testing, to make sure that you don't have any undiagnosed STIs. So I don't want people to think that somehow, this drug has been created and all your worries around STIs and other concerns are now being addressed because one drug will cure everything. It's not. Secondly, it's not a cure. It's a treatment for making sure that we can, you can stop the acquisition of HIV or onward transmission of HIV if you're HIV positive and you're on PrEP. But I think it's also important to clarify that, the due diligence of the drug requires that it's not an over-the-counter prescription. You can't go to your pharmacist and get it. You need to go into a level 3 GU clinic, sexual health clinic, and you will, if you are interested in accessing the drug, you then need to go through an assessment with a consultant who would then obviously go through an assessment evaluation with you, and then they will determine whether whether PrEP is applicable for you. So, just to emphasize that it's not a one-stop shop treatment.
And to those like me who've never seen it, have never used it, how effective is it?
So, to my understanding, and I appreciate that, the consultants out, the sexual health consultants will have a better grasp of this data than me, but to my understanding, it's highly effective. The trial that was done through a pilot program that was run a number of years ago identified or showed an efficacy, that's a success rate of about 90% in terms of stopping people either acquiring HIV or onward transmission. But again, I believe that efficacy will only increase as time goes on, because obviously that was done with a small group of people, small pilot group.
90% they gave it.
Yeah. So a small pilot group. So and this is why it goes back to the first question you asked me, which is why are we having this focus on Black African community? It's important when you have a treatment or a resource of this nature, where we know HIV does impact adversely in our community, that we make sure we're promoting and ensuring that it's equality of access. We know that historically we face barriers around healthcare in the UK, and we're still facing barriers. I think in the recent news there's been this, the latest thing in the news is the very unfortunate experiences of a lot of Black and Asian women during childbirth, and the experiences that they've had. So that already is bringing the inequality and racial prejudices back into the spotlight. So, when we've got innovative drugs like this available, it's incumbent on people like myself and you and other people who represent our communities to really make sure we promote it and we make as many people aware of it, so that they can make informed choices as to whether it's a provision that they want to have access to and they want to use based on their personal circumstances.
But would you also admit that the Black Africans in the UK would be disproportionately affected by, let's say, HIV?
So there are a number of vulnerable groups who I say vulnerable. What I mean is that there are a number of groups which are disproportionately affected by HIV, and the data tells us that Black African communities is one of them, particularly those who are born in sub-Saharan African countries, and who are recent migrants, simply because we have a high prevalence of HIV in some countries in Africa. But again, I think it's really important to emphasize, and this goes back to that whole notion of stigmatization. When PrEP is not another tool to stigmatize our community. It's saying this is available and you need to be informed about it so that you can make an informed decision as to whether you feel this is applicable for you. And I think I need to emphasize that, because I appreciate, and I think I said at the beginning of our conversation, that historically we as a Black community have always felt that people have either talked about us, talked at us, but never talked with us. Never really kind of come in and said, look, I really want to understand how these different communities that represent the Black community in UK live and contribute to society, and we contribute positively to society. So I really want to emphasize that. So, HIV is we have a high level of proportionality of HIV diagnosis in our community, but I want to emphasize that we're not talking like I don't want people to assume that, once again, people are making the assumption that every single African person in the UK is HIV positive, and we need to do something about this issue because it's becoming a concern. It's actually saying, no, this is about making sure that if you need a service, you know where it is and you know how to access it.
And I would ask you, should we all know about PrEP, or at what point do I as an individual declare that PrEP ain't for me?
Isn't it for you, or is?
Isn't for me.
Well, so again, you can make that judgment based on your own personal circumstances. And one of the ways you can obviously do, one of the things that you can do is making sure you regularly test for HIV, making sure that you're using safer sex practice. So, but that's determined by you as an individual based on your personal circumstances and how you have your sexual relations with people. It's not. I'm not in a position to say, oh well, Banda, you know what? It doesn't look like you need PrEP, because I don't know your personal circumstances. But through you, if you are interested in being part of accessing PrEP, then the opportunity is there for you to, go to your local sexual health level 3 sexual health service and, place your interest or declare an interest. And like I said, I think earlier on, you would then have a consultant who will assess you and have a discussion with you to find out whether one, you do need it, based on the conversation, not based on the information you've disclosed to that consultant, and whether PrEP is a viable option for you. I don't want people to assume that, it's a guarantee that you're going to get PrEP, because actually it's determined by your lifestyle and what information you disclose to the consultant that will determine whether they feel that this is an option that you should be part of you could be part of.
And if you're to change anything about PrEP, as a prevention tool for HIV, in terms of how it's marketed, how it's distributed, what would you change? Just based on your own experience and observations.
That's a really good question. Banda. I don't know whether it's something, I don't know if I would use the word change. I think marketing is very much about, and I think I use that word combination prevention strategy, which is basically saying to people, look, you determine the circumstances you're in as an individual in terms of your sexual relations. And some people know how to navigate and are very confident in navigating their sexual relations, and are informed and or well informed, should I say, and know how to access services appropriately. But for some people, that's not the case. But what we need to be able to do is make sure that for those people who are struggling to navigate good sexual health information and access of services that is appropriate for them, they know where to go to. And I think, we certainly market PrEP as part of the wider HIV prevention campaign. So obviously, we've got National HIV Testing Week. We talk about It Starts With Me in terms of the testing for HIV. We can make sure we tag PrEP along with it, and I believe that's going to happen. We have the Do It London campaign, which also makes sure that it tags on the PrEP as part of the combination prevention approach. So I think, for me, in terms of the Black African community, it's how I promote it is making sure we have platforms like this, talking to people like yourself, where we've got a radio station that has an audience of people who are from our community. We make sure that we're working with local charities, local groups who have really good insight, really good engagement with the various communities in their respective boroughs, making sure we can even, put together, small online discussion forums, on Zoom, where, we're just giving a platform for people to ask questions. Because the more people ask questions, the more informed they are about facts. Because what we don't want is people just going online and going on any website, which is providing them with false information that's not appropriate to what PrEP does and how they can access it.
And for those who are visiting the UK, let's say from Africa, when you arrive here, you are hit with so many things. The food is different, the way of life is different, many things are different. Do you think that we should have some pit stop somewhere where they can get this information, because it takes a while before you fuse into the community?
Sure.
What do you think? Some of them could be having HIV.
Absolutely.
Yeah. What would you advise they do?
So I think the first point of call is obviously when they've kind of got this, taking stock of their bearing, their new environment, their weather, wearing big coats depending on what time of the year they come. We're fortunate that particularly in London, that there's a lot of NGOs, lots of charities which are operating in London, which are representative of different communities from parts of Africa. So I think the first point of call is maybe go to their local volunteer centre and to find out what charities, support them as a community. And those charities are usually gatekeepers to services, mainstream services that people can access, because they should be the repository of information for their local council or their local borough. So I think that's the first point of call, because going to them just saves you a lot of unnecessary time and anxiety about where to go and access information. And so that's what I would suggest, or I would advise, to find your local charity, Black African charity, and then again you can, and even if you don't know where to start, you can go to your local council and find out. And I appreciate if we're delving deeper, there may be people who have come here with no recourse to public funds
or refugees.
Absolutely. But again, one of the things where we have to commend the UK for is that there was a very brave decision made many years ago to make sure that anybody who is HIV positive can still acquire their treatment irrespective of their status in the country.
I did not know that.
Yeah,
go again.
So basically, if you have no recourse to public funds, and you're obviously a legal immigrant in this country, if you are diagnosed with HIV, up until when obviously your paperwork and everything is resolved through the Home Office, you can access treatment. You can access your HIV treatment. But obviously, I know we're not talking about HIV. We're talking about HIV in a wider context. Obviously, it's a conversation about PrEP. But you're asking me about a question about how to navigate services when you're a new migrant into the community, particularly around sexual health. So the first, obviously you got a CAB there, you got a Citizen Advice Bureau. But I appreciate that, like I said, that they are members in our community who may not feel confident enough to present themselves to these organizations, but they can certainly go to their local, the nearest Black African community organization and have a conversation as to how they can access sexual health services.
I'm acutely aware that we do not have HIV cure.
Yes, absolutely.
But we do have PrEP.
Yes.
And maybe I should just ask you, in which ways do you think PrEP is a game changer?
So PrEP is a game changer because it stops the acquisition of HIV and onward transmission of HIV, even if I'm HIV positive. But the caveat to that is providing that you are following very clearly the treatment guidance that's been provided by your consultant for PrEP. So that's why it's a game changer. But you emphasize, you highlighted the point, Amanda, it is not a cure. And I think people need to understand that it is part of a treatment, of provision, of treatment provision for reducing HIV, overall HIV diagnosis in the country. Yeah, so it's really important we emphasize that it's not a cure.
Akeem, one thing I realized we didn't talk about is who should be taking PrEP. Is it the one who wants to guard themselves against HIV or the one who has HIV?
That's really very much based on a personal, individual basis, because only you determine what your sexual journey is. And you need to be, as I think I mentioned earlier, you need to be informed enough about what PrEP is and how it can help to reduce your, you've been, acquiring HIV or passing it on. But taking a step before that, it's really important that you continue to regularly test for HIV.
Yeah.
These are part and parcel of the process. You're not going to be given PrEP in isolation. There's not going to be a case of, okay, well, we're not, I think you're going to, you need to be able to take charge of your sexual health journey. And part of that is to say, I will make sure I'm regularly testing for HIV. Because again, remember, and I think it's important to emphasize this, the earlier we test, the more effective the drug, if you are positive, the more effective the drug is for managing your HIV diagnosis. Okay. Yeah, the longer you wait to test, the more the HIV virus has an impact on your health, and therefore there may be it's just really important that you understand what those stages are. Regular testing in the first place, then obviously depending on the circumstances you are in your sexual health, in your sexual relations, whether then PrEP is a determining factor for you in that stage. But obviously re-emphasizing the fact that PrEP does not stop you from acquiring other STDs or sexually transmitted infections.
I get that. And in closing, I'll just ask you, what are the takeaways to our listeners, those who've been listening to you talk about sexual health and pre-exposure prophylaxis, what would be your parting shot to them?
Oh God, that's a good question. So my parting conversation piece will be, first of all, it's really important as our community to not shy away from having conversations around good sexual health, journey. To understand that it's not something we need to be ashamed about. Everybody, or virtually everybody on this planet does it. Will do it at some point in their life.
With the product
with the products of sex. So it's important that we don't shy away from it, because ultimately, and I kind of want to pitch this to our kind of more kind of the older generation, because in our from our background, there's one commonality around Africa, is that we place a real emphasis on respecting our elders. So I kind of speak to the elders here, that it's really important that they kind of, be brave enough to know that actually we need to try and normalize talking about sexual health. Not just split that word into say, we just want to talk about sex. No, we're talking about good sexual health. Mm-hmm. And it's important that we create a platform where the younger generation do not feel embarrassed, do not feel uncomfortable, do not feel that they will be stigmatized or looked on, or frowned upon if they genuinely have a question about sexual health. Doesn't mean that we as the older generation have to be the repository of all knowledge, but you need to create a platform where you can say, look, you can come and talk to me about these things, and there are more specialized, dedicated services and sites where you can go to get to be informed about, your sexual health history and that journey that you want to go on. So I think that's what I would like to say about that. And finally, on PrEP, absolutely, I encourage our community to come forward if they feel that it's a resource that would be of benefit to them. They shouldn't feel shy. They shouldn't feel embarrassed. It is there. It is open to our community. It's justifiable for us to have access to it. And ultimately, this is about making sure we create an even playing field, making sure that the same services is available to one group of people who are affected by HIV. In terms of prevalence, it can also be, available to another group, i.e. our community, who are equally affected by the prevalence of HIV.
I'm truly very thankful that you came to our studios at Sauti Radio to talk to us about sexual health and pre-exposure prophylaxis. Mr. Akeem, I think the next phase of our conversation, I would have told you something about our campaign in the community and what it is that we're doing to make sure that these messages go to the people they need to get to. Thank you so much, Mr. Akeem, and I hope that we will be seeing you very soon for the second phase.
It's been a pleasure, Obana. Thank you very much, and I'm more than happy to come back at some point, maybe have a roundtable discussion with the other members practitioners to delve into this a bit more. But it's been a pleasure.
Thank you so much. Lovely. Why is sexual health important? Or rather, why does it matter? Have you heard about PrEP? What is PrEP? Who should take PrEP? And when should they take it? Are there conversations about PrEP among the Black community in the United Kingdom? If not, how can we begin these conversations? Why is PrEP-related awareness crucial at this time among the Black community? Is PrEP apathy among the Black community a consequence of mistrust, and could it be time to engage anew in discussions about PrEP? Sauti Radio shall continue with these discussions in the next program. We hope you will join in to give meaning to these conversations. We firmly believe that your engagement will help us achieve our goal in the community. Ultimately, Sauti Radio aims to achieve equity in pre-exposure prophylaxis awareness, especially among the Black community in the UK. This is why your engagement as a listener and/or caller is key in this participatory awareness exercise via Sauti Radio. I am Oumai Obanda, Sauti Radio's program presenter and moderator in London, United Kingdom. Until next time, goodbye. 1,
You're listening to your radio station.
Sauti Radio.